Psychological symptoms of vitamin D deficiency. Vitamin D is one of the very important vitamins that contribute to building the health of the body greatly, and therefore some people wonder about the psychological symptoms of vitamin D deficiency and its effect on the body and on health in general. Vitamin D deficiency. Vitamin D is one of the important vitamins that are considered steroid hormones that can be produced when the skin is exposed to sunlight, but it is most likely that an adequate proportion of vitamin D is not obtained from sunlight alone. It can also be obtained through many important and specific foods in which vitamin D is present, or by consuming nutritional supplements that contain vitamin D. But many people may wonder about the psychological symptoms of vitamin D deficiency. Psychological symptoms of vitamin D deficiency. Vitamin D is one of the important vitamins that contribute to stimulating the brain significantly, as it helps in treating the nervous system. Therefore, those suffering from depression or frequent mood disorders have symptoms of vitamin D deficiency. A medical study related to this field that was conducted on a large number of people who reach the age of 50 years showed that a lack of vitamin D may lead to many symptoms of depression, feelings of loneliness, sadness, boredom, and the desire to do nothing. In addition to that, there are many psychological symptoms of vitamin D deficiency that can appear on a sick person with a vitamin D deficiency, including feeling constant headache in addition to pain in the back, the inability to feel happy in the activities that the individual previously liked, inability to enter the sleep phase, or conversely, cravings for sleep and detachment from reality, feeling very anxious, forgetting a lot of things that go through the day, cravings for death, weight loss or an increase in average weight, feeling very sad about a lot of things, constant fatigue, extreme lethargy, and unwillingness to do anything. Causes of vitamin D deficiency in the body. After we got acquainted with the psychological symptoms of vitamin D deficiency, we must recognize many factors that are the cause of vitamin D deficiency, as follows. Dark skin lacks melanin, which contributes to the production of vitamin D. Therefore, people with dark skin need exposure to sunlight. Dysfunction of the kidneys is one of the reasons that can lead to a deficiency of vitamin D in the body, as it causes an imbalance of vitamin D. A stomach ulcer or other functional disorders in the digestive system may cause a vitamin D deficiency. Insufficient exposure to sunlight, especially for people who live in areas close to the equator. The presence of a high rate of obesity in the body, as a result of the blockage and accumulation of vitamin D within the fatty tissue. A deficiency in the level of vitamin D occurs in children during the breastfeeding period, as breast milk does not contain an adequate level of vitamin D. A significant decrease in the level of vitamin D in the mother may occur during pregnancy and lactation, and some research has shown that a lack of vitamin D during this period may cause premature labor. Having a deficiency in foods that contain vitamin D, or following diets that lack vitamin D in them. People with a milk allergy and lactose intolerance also have low levels of vitamin D. A person follows a vegetarian diet that does not contain vitamin D, which affects their bodies and causes a decrease in vitamin D levels in the body. Vitamin D benefits. Vitamin D is considered one of the important elements for the health and growth of the human body, as it helps build bones and helps maintain the health of the body, as it cannot absorb calcium in the body unless there is an adequate proportion of vitamin D in the body. Treating vitamin D deficiency. Treating vitamin D deficiency helps increase vitamin D levels to the normal range required for human growth and to maintain good bones. The treatment of the deficiency in the level of vitamin D can be done by consuming adequate amounts of vitamin D for a full month, and then the dose is gradually reduced to reach a specific dose decided by the doctor. If the patient suffers from a deficiency in the level of calcium or muscle cramps along with a deficiency of vitamin D, the doctor will recommend taking calcium as a dietary supplement in addition to taking vitamin D. If the patient suffers from liver disease, he will be treated with a specific formulation containing vitamin D specifically to treat these conditions. It is worth noting that vitamin D deficiency must be treated by a doctor so that no problems or complications occur during treatment. Tips to avoid vitamin D deficiency. There are several important tips that you must follow in order to avoid the occurrence of psychological symptoms of vitamin D deficiency, and most of these tips are related to the daily routine that a person follows, and they are as follows. Eat foods high in vitamin D, such as egg yolks, cheese, fish, liver, fortified breakfast cereals, orange juice, and more. Be sure to take nutritional supplements that contain vitamin D, but some consult your doctor about the possibility of taking them. Increase exposure to the sun, which is beneficial to the body greatly in replacing the vitamin D deficiency, in addition to following important nutritional advice.